Hi, this is Dr. Jenn Kennedy, and I wanted to jump on and just give you some information about when it might be time to come into sex therapy. Why is it helpful? Who is it for? What do we do in here? Right? I get that question a lot. So I will say the primary reasons that people come in are either dysfunction or dissatisfaction. And I will say that couples come in, but individuals also come in because sometimes these things are just happening and it prevents them from being in a partnership, or it hampers their dating, or it hampers their own relationship to their sexuality. So you don't have to be, even if you are in a partnership, you don't have to come in as a couple. Sometimes it's very helpful if it feels like it's a more relational issue, but not necessarily, it doesn't have to happen that way. So let's start on the dysfunction side of things. With men, that tends to look oftentimes like erectile dysfunction, like things just don't work like they used to, or things don't work like you want them to. And with ED, that can definitely happen as a factor of age. It can also happen because of anxiety. It can also happen because of certain medications, specifically around blood pressure. Like there's different causations, but that might be the presenting issue, is that things aren't working right. With women, it tends to be dysfunction looks like pain, or it looks like, there's a lot of hesitancy. Sometimes there's involuntary spasming that can happen. So there's certain things physically that are presenting that are causing dysfunction. So we kind of go down one road with that. Now, the other side of things is dissatisfaction. So that's going to look like maybe you just don't like the quality of sex that you've been having. And if that is the case, it's going to be hard for you to make a case to yourself to show up for it, to prioritize it, to feel excited about it, to feel like you want to reciprocate energy that's coming at you if your partner is initiating. So dissatisfaction is wide open, right? There's lots and lots of reasons for dissatisfaction. It sometimes is sort of the technical way that sex is happening doesn't feel good to you. But I would argue even in that case, it's still relational because there is likely a lack of communication happening between the two parties. Because if you want something to be different, you have to know how you'd like it different. And then are you willing to tell your partner that? So some of it is, knowing kind of what the dissatisfaction is around. Now, the dissatisfaction also might not be like approach of the partner in terms of like the technicality of it. It might be the approach emotionally, interpersonally, like what's going on between you and how does that get in the way? Are you getting along? How did things look 20 minutes or 2 hours or 2 days before the initiation started? So looking at kind of the larger picture of what does this relationship include and how are you two interacting with one another, because that makes a huge difference. Makes a huge difference. Because if relationally you are strong, if there is a liking of one another, if there is a trusting of one another, there's more likely to be willingness to communicate about likes and dislikes in the bedroom. There is more trust in terms of speaking up and saying what you like or negotiating needs. Like all of that is more possible when there is relational harmony, or at least, some degree of mutual respect and flow. So I get really curious about sort of what door are people coming into. There's also the door of their own relationship to self, because certainly there is plenty that we can get in our head about in terms of body image, stress about millions of things, including work, including finances, including family, including, how do we look, how do we sound, how do we feel, all of that. So anxiety can be crippling in this sphere. And I see that quite a lot, both with men and with women. Definitely comes in. So sex therapy is a really good place to get curious, to unpack kind of where have you been historically, where do you want to go? What are your reasons and motivations to even be in this space and to participate? Because you have to have a why for you to discover a how of doing this. If you don't really have a compelling why that you want to be engaged in some erotic space with another or with yourself, then it's probably not going to go very far. So that is part of what we do. It's this kind of meandering uncovering of like, what is this about for you, and how do we help you shift in a way that feels positive and feels affirming. So that's kind of a snapshot of what we do in sex therapy. I am about to announce, I've had my pleasure circle for women, and I'm going to announce another round of that coming up. But I'm also going to announce that I'm doing a couples option. Now that is going to be in person initially. So for the folks located in my area, which is Santa Barbara, Ventura, Carpinteria, that type of thing of California, you would be eligible. I think I'm guessing if you're much beyond that, it would be too far to do. But down the road, I'm going to be rolling out couples online, as well as retreats or intensives. So if you would be interested in coming to California, coming to Santa Barbara, which is a pretty great place to be, you could also do that. You could come, you could stay for a couple nights, do this intensive with your partner. That's a great option. And then the other option would be online, if you can build it into your schedule. I do actually kind of like having a little bit of time in between. So depending on kind of how you're wired and what works for you, one model might be better than the other. The other piece that I'm really starting to notice is how important the somatic piece is. That is body-based, right? Sex is one of those things that is body-based. Now, some people can sort of separate their head from their body, but really so much of this, how you feel, how you respond, is a mind-body loop that is happening. So I am also going to encourage people to kind of look at historically where they've been, but also how are they entering this room? How are they entering this work? And what are they hoping to do? So if you are interested in this conversation, please follow me here. First of all, you can also follow me on Instagram. That address is Dr. Jenn Kennedy. And would love to get your questions, would love to include you in the conversation, and of course include you in participating in these events as they roll out. So let me know, and I look forward to hearing from you.